Tibetan Buddhists spend a lot of time cultivating kindness and compassion. In fact, many other spiritual leaders advocate for kindness and compassion. But what does kindness and compassion has to do with brain imaging? This is a brilliant question, and let me answer that. Previously, I spoke about radiologists making mistakes in terms of identifying anatomical location of a lesion. And I know plenty of clinicians, rehabilitation clinicians, that get really irritated with mistakes that radiologists do. And this is probably because in their mind, the radiologists are the ultimate authority in terms of brain imaging. So they can't make mistakes because they're the ones who know the best. And I think, well, the point I'm trying to make with this video is that we actually need to approach radiologists with a bit more kindness and compassion. Because if we think about what they're trying to do and their way of thinking, we can understand that it's inevitable that sometimes they will make mistakes. In this diagram, you can see 3 cogwheels, and they represent the thinking process of a radiologist. So in the middle, you've got the largest cogwheel, and that's for diagnosis. The radiologist is trying to come up with a diagnosis. And linked to the diagnosis is a smaller cogwheel, which says pathology. So the radiologist uses brain imaging to identify features of pathologies that they can then use to make the diagnosis. And you can see that the pathology has another small cogwheel in contact with it, and that's anatomical location. And the anatomical location is something that is a byproduct of having a lesion. So there is a lesion, therefore the lesion is somewhere, and therefore the radiologist might talk about it, but not necessarily in great detail, because it's not the main thing the radiologist is concerned with. The radiologist wants to be able to come up with a diagnosis. The 3 points are that 1, you need to know that the most important thing for the radiologist is the pathology. 2, you need to understand that the most important thing for you as a rehabilitation clinician is the anatomical location. And 3, you need to understand that there is a difference between the 2. So what's most important for the radiologist is the pathology, and what's most important for you is the anatomy, and they're not the same thing. Now, accepting this difference can be a little bit challenging. And I think it's challenging because if you accept it as a clinician, if you accept that the anatomical location is not important for the radiologist, but it's important for you, and the anatomical location is not a huge important part of the radiologist's job, then it means that it is your job as a rehabilitation clinician to identify the anatomical location. And if it is your job, it is your responsibility to learn brain imaging. And if it is your responsibility to learn brain imaging, then you need to take action. Now, some people are a bit uncomfortable with that. Some people are not ready to learn brain imaging, and some people are. If you are one of those people who are ready for learning brain imaging, head off to my website and you can find some information about courses there. But the point I'm trying to make in this video is that we need to have kindness and compassion to radiologist and radiologist reports, because there will be mistakes there. And the mistakes will be because what's important to them is not what's important to me or to you as a rehabilitation clinician. So I hope I helped you cultivate kindness and compassion towards radiologists, and I'll see you in the next video.